Americans face a 3-year loss to their life expectancy at birth, the second steepest drop over the last 2 decades. This was the finding of a report published in August by the U.S. National Center for Health Statistics. This echoes a latest health indicator report by the OECD, the Organization of Economic Cooperation and Development, which found the drop in life expectancy in the United States to be particularly large compared to other developed countries. What exactly does this mean? How much was COVID-19 to blame? Why is American life expectancy fluctuating, and how severe is the situation? I'm pleased to be joined from Beijing by Professor Hu Naijun of the School of Public Policy and Management at the University of Chinese Academy of Sciences, and from Washington, D.C. by Dr. Eric Ding, epidemiologist and chief of the COVID task force at the World Health Network. Gentlemen, welcome to The Point. So, Eric, let me go to you first. According to the U.S. report, U.S. life expectancy at birth had been rising steadily, although the rise has been very, very slow, but it has been rising steadily at least since 2000. But since 2019, it had a sudden nosedive, with the average life expectancy dropping from 78.8 to 77.3 in 2020. That's a drop of 1.5 years, and that was the steepest in the 2 decades. Now, the decline continued in 2020 to reach 76.1. That's another drop of 1.2 years. Help people understand what exactly is life expectancy at birth, and from a purely scientific point of view, what does the drop mean? Can we say the average Americans have to expect to live shorter?
Well, life expectancy, obviously, if a child born today, how long they would expect to live into the future from all causes, whether it's childhood mortality or adult mortality. And to really turn the needle on life expectancy, it actually requires a huge rise in mortality. But that is exactly what we saw during the pandemic. The U.S., especially from 2020 to 2021, a lot of minorities died at much higher rates, a huge disparity. But from 2021 to 2022, a lot of, in addition, the past year, a lot of white Americans died because of not getting vaccinated, refusing to vaccinate. So there's a whole slew of racism, and as well as, of course, not getting vaccinated, and just the U.S. healthcare system being much more vulnerable than many other countries, and that's why you don't see as sharp of a drop in other OECD countries, and you don't see that sharp of a drop in Europe either.
Professor Hu, according to the same report, COVID-19 was the leading contributing factor to this decline, accounting for as much as 70% in 2020 and 50% in 2021. And we know that the total excess deaths from February 2020 to August this year, 1.2 million for the United States, and 90% of these were attributed to COVID-19. Can we say COVID-19 shortened U.S. life expectancy by 3 years? I mean, that's quite an astonishing number.
I think it's still too early to make the final judgment because of lacking of data or detailed data. But in my opinion, I think the life expectancy at birth is a statistical data. It's not simply as that you ask the dead people what is his age, then you calculate his age. It doesn't work in that way. It is a kind of calculation to divide people in different age groups, and then they calculate each age group's mortality rate. That is to say, if the very old age group has a higher mortality rate, then the life expectancy will decrease. So I think comparing different age groups, we can see the elder population age group is also vulnerable people to COVID-19. So that is why some people may say that COVID-19 may contribute to this dropping of the life expectancy in the United States of America, since the very old age group people are, in my opinion, are more vulnerable to COVID-19. So some people may say that, but we can't say it without any scientific research or the detailed data analysis.
So you say it may be because of COVID-19 that the life expectancy has dropped by about 3 years in the United States, but we need more scientific evidence. Is that what you're saying, Professor Hu?
That's right, because we can only make some reasoning because
Okay.
the elder age group people may
Okay,
more
but in terms,
vulnerable to the COVID-19.
right, but in terms of an indicator of how the society is healthy, how the population is healthy, how the public medical, healthcare system is functioning, how indicative is this life expectancy number? Because every country more or less calculate using a similar way, Professor Hu.
Yes, but there are so many factors. For example, it is more than 10 years ago that some researchers may say the life expectancy can be attributed to different healthcare systems. Because as we all know that comparing with US healthcare systems to European systems, US healthcare is more expensive. People have to buy insurance. That is to say, the public healthcare service may serve less in the United States of America. However, in the United Kingdom, they have the NHS system, which makes United Kingdom's people's life expectancy much higher than the United States. So I think there are so many factors, and I think COVID-19 may be
Okay.
one of the most obvious factor in
All
that.
right. The OECD health report published earlier this year showed similar trends and numbers, Eric. It says the drop in the United States is particularly large in 2020 in terms of life expectancy, and it's the lowest among G7 countries. Why was the US getting hit harder, and how much was the US's COVID response to blame for this drop?
Yeah, so the US definitely got really hit hard. And I think it's a combination of the US healthcare system not being a universal healthcare system like European countries. Most European countries have a government funded system, and the poor are able to access healthcare relatively inexpensively, while the United States, the system is very stacked against those who are poor. And so the cost of medications and drugs similarly. And the U.S., I think, vaccine refusal was much larger than some other countries where the vaccine uptake was much higher in many ways. And I also want to point out it's not just direct causes from COVID, but it also includes, for example, when hospitals are full from COVID patients, there's indirect deaths from heart attacks. Basically, you can't get an ambulance to treat your heart attack or stroke. And of course, there's long COVID. Long COVID is the long-term impact of COVID.
Right.
And we know that cardiovascular mortality increases in long COVID, even if it's directly COVID in the short window of time during the infection. So I think it's a combination of factors, vaccine hesitancy, but also just that U.S. Has a very vulnerable healthcare system, and a lot of people fall off.
Policy? What about policy? Because obviously, in the beginning, in the first year and the second year of pandemic outbreak in the United States, the policies were very much controversial. Eric.
Yeah, I think in certain ways, the American resistance to zero COVID approaches is much stiffer than other countries. Australia, New Zealand were much more stiffer, and also, contact tracing. The U.S. did much less contact tracing, and of course, lockdowns. U.S. only did a brief lockdown. It's a very soft lockdown. Now, obviously, it's not sustainable for 2 years, but compared to other European countries, and that's the question, and other OECD countries, U.S. is much more resistant to a lot of these mitigations, and did not practice as much of the contact tracing and airborne transmission precautions as many other countries. So it's a combination of reasons in which how we drop the ball.
Professor Hu, the U.S. report also mentioned the second largest contributing factor of the change in life expectancy is the increase of unintentional injuries, which was largely driven by drug overdose deaths in 2021. And it was the same case in 2020. How impactful has the worsening drug epidemic been, which has weighed down life expectancy?
Well, I think I agree with Eric completely on this combination of factors. So, as you have mentioned, such as the drug abuse to induce the injuries, in my opinion, I think that may be linked with political or societal, also social factors in different countries. I think in United States, I think there are the controversial debate between different major political parties, between different groups about the drug and about the control and some kind of measures or policies. So I don't think there is a consensus in the United States society that the drug could be contained. But in
Okay.
other countries, such as in China, there's no other opinion than to contain the drugs, contain the abuse of drugs, etc., etc. So I think so many factors, such as political, social, economical, or cultural, I think a lot of factors can be attributed
Right.
to this kind of change of
There's
life
Yeah.
expectancy.
There's also definitely the other dimension, which Eric mentioned just now. If you look at the differences by origin and race, for the year 2020, life expectancy dropped across the board. But last year, when the situation was turning for the better, non-Hispanic white people still experienced a one-year drop in their life expectancy, whereas other groups seem to have bucked the trend, with the exception of AIAN, which is non-Hispanic American Indian and Alaska Native. And overall, Black people and Native Americans have always been the more vulnerable groups with their life expectancy considerably lower than the Hispanics, Asian, and white people. Eric, your comments.
Yeah, I think it's a combination of, in the early pandemic, a lot of minorities were forced to work in a lot of these more dangerous jobs. But then the vaccines rolled out, and minority uptake of vaccines is became actually higher than whites. We know that non-Hispanic whites in America, vaccine resistance among a lot of conservatives was extremely stiff, and therefore vaccine uptake was much lower. So once a lot of businesses reopened in mid to late 2021, oftentimes it was the unvaccinated non-Hispanic whites who got hit the hardest because their vaccine uptake was the slowest. I think that's the most obvious reason for the crisscross of how white mortality exceeded Black mortality in the second year of the pandemic. And it's very unfortunate. And it's the politicization of vaccines and masks. Also, the hesitation to wear masks among a lot of conservatives dropped a lot. And I think it's very unfortunate.
Okay, we're going to leave it there. Hopefully things will get better slowly. Many thanks to Professor Hu Naijun of the Chinese Academy of Sciences and Dr. Eric Ding from World Health Network.